Question 1. Comparative studies suggest that commercial insurance reimbursement models are increasingly shifting towards value-based care arrangements. A medical coder is tasked with ensuring accurate reimbursement for a physician group participating in a new capitated contract with a major commercial insurer that includes performance bonuses tied to patient adherence to preventative care guidelines. Which of the following approaches best aligns with the principles of accurate coding and reimbursement under this model? Option A. Diligently review the specific terms of the capitated contract, including the performance metrics for patient adherence to preventative care, and ensure coding practices reflect the achievement of these metrics where supported by documentation. Option B. Focus on accurately coding all services rendered according to standard CPT and ICD-10-CM guidelines, ensuring that the documentation supports the medical necessity of each individual service provided. Option C. Prioritize coding for the highest-paying procedures and diagnoses to maximize reimbursement, assuming the insurer will audit and adjust as necessary. Option D. Apply the same coding strategies used for traditional fee-for-service plans, as the fundamental principles of medical necessity and accurate diagnosis coding remain constant across all reimbursement models. The correct answer is B. Focus on accurately coding all services rendered according to standard CPT and ICD-10-CM guidelines, ensuring that the documentation supports the medical necessity of each individual service provided. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical coder to navigate the complexities of commercial insurance reimbursement models, specifically focusing on value-based care arrangements. Coders must understand how these models differ from traditional fee-for-service and how accurate coding directly impacts provider reimbursement and patient outcomes. Misinterpreting these models can lead to incorrect claims, financial penalties, and damage to the provider-patient relationship. Correct approach analysis. The correct approach emphasizes understanding the specific contractual agreements and performance metrics associated with the value-based care model. This aligns with the Certified Professional Medical Coder certifications, focus on accurate coding for appropriate reimbursement. By focusing on the contractual obligations and the specific quality measures tied to reimbursement, the coder ensures that the submitted claims accurately reflect the services provided and contribute to the provider's performance under the value-based contract. This approach upholds ethical coding practices by ensuring transparency and accuracy in reporting, which is crucial for fair reimbursement in these evolving payment structures. Incorrect approaches analysis. One incorrect approach involves solely focusing on maximizing the number of billable codes without considering the underlying value-based contract. This is a failure to adhere to the principles of value-based care, which prioritize quality and outcomes over volume. Such an approach can lead to upcoding or unbundling, violating ethical coding standards and potentially fraudulent practices. It also fails to acknowledge the payer's perspective, which is to incentivize efficient and effective care. Another incorrect approach is to ignore the specific performance metrics outlined in the value-based contract and continue coding as if it were a traditional fee-for-service model. This demonstrates a lack of understanding of the reimbursement model's core tenets and can result in the provider not receiving appropriate reimbursement for meeting quality targets or, conversely, being penalized for failing to do so. This approach is professionally negligent as it fails to adapt coding practices to the prevailing reimbursement strategy, directly impacting the financial viability of the practice and potentially patient care. A third incorrect approach is to assume all commercial payers utilize the same value-based reimbursement model. This is a critical error as contracts vary significantly between payers and even between different plans offered by the same payer. Failing to investigate the specifics of each contract leads to misapplication of coding guidelines and incorrect reimbursement calculations, undermining the integrity of the coding process and the financial health of the healthcare organization. Professional reasoning. Professionals should adopt a systematic approach. First, thoroughly review the provider's contracts with commercial payers, paying close attention to any value-based care agreements. Second, identify the specific performance metrics, quality indicators, and reimbursement methodologies outlined in these contracts. Third, ensure coding practices directly support the accurate reporting of these metrics and align with the payer's expectations for value-based care. Finally, Engage in ongoing education to stay abreast of evolving reimbursement models and coding guidelines relevant to value-based care. Question 2. Risk assessment procedures indicate a patient presence with a persistent cough and shortness of breath. The physician's documentation notes these as the primary complaints and lists several potential diagnoses, including bronchitis and pneumonia, but states that further diagnostic testing is pending to confirm the exact etiology. According to the ICD-10-CM official guidelines for coding and reporting, what is the most appropriate coding approach for this encounter? Option A. Code for pneumonia, as it is a serious potential diagnosis that should be considered. Option B. Code for bronchitis, as it is listed as a potential diagnosis. Option C. Code for the most severe potential diagnosis listed, regardless of confirmation. Option D. Code the signs and symptoms of cough and shortness of breath, as a definitive diagnosis has not been established. The correct answer is D. Code the signs and symptoms of cough and shortness of breath, as a definitive diagnosis has not been established. Explanation. This scenario presents a common challenge in medical coding, determining the appropriate ICD-10-CM code when a definitive diagnosis is not yet established, and the patient's presentation is primarily based on signs and symptoms. Professional coders must navigate the guidelines to ensure accurate and compliant reporting, which directly impacts patient care documentation, billing, and statistical analysis. The challenge lies in applying the principle of coding to the highest degree of certainty available at the time of encounter, without overcoding or undercoding. The correct approach involves selecting an ICD-10-CM code that accurately reflects the signs, symptoms, or abnormal findings documented by the physician, as per ICD-10-CM official guidelines for coding and reporting. Specifically, when a definitive diagnosis has not been established, and the signs and symptoms are the reason for the encounter, coders are instructed to report those signs and symptoms. This aligns with the principle of coding to the highest specificity documented, ensuring that the patient's condition is represented accurately in the absence of a confirmed diagnosis. This practice is ethically sound as it avoids misrepresenting the patient's condition and complies with regulatory requirements for accurate medical record documentation. An incorrect approach would be to assign a code for a suspected or probable diagnosis when the physician has not documented it as such. This violates the ICD-10-CM guideline, stating that signs and symptoms should be reported when a definitive diagnosis has not been established. Ethically, this constitutes misrepresentation of the patient's condition. Another incorrect approach would be to assign a code for a condition that is only a differential diagnosis without further investigation or physician documentation supporting it. This also leads to inaccurate reporting and potential billing fraud. Finally, assigning a code for a condition that is ruled out by the physician is a direct violation of coding guidelines and misrepresents the patient's encounter. Professional decision-making in such situations requires a thorough review of the physician's documentation, understanding the hierarchy of coding guidelines, and recognizing when to query the physician for clarification if the documentation is ambiguous. The coder must prioritize accurate representation of the patient's condition based on the documented evidence at the time of service, adhering strictly to the ICD-10-CM coding conventions and guidelines. Question 3. To address the challenge of a physician documenting a procedure that appears to be more complex than the code assigned, leading to a potential discrepancy in reimbursement, what is the most appropriate course of action for a certified professional medical coder? Option A. Ignore the discrepancy in code based on the initial documentation, assuming the physician is aware of the coding implications. Option B. Sign the higher-paying code that seems to align with the physician's perceived intent, assuming the documentation is implied. Option C. Assign the lower-paying code that is directly supported by the existing documentation without further inquiry. Option D. Query the physician for clarification and additional documentation to ensure accurate code assignment. The correct answer is D. Query the physician for clarification and additional documentation to ensure accurate code assignment. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a coder encounters a discrepancy between the physician's documentation and the services actually rendered. The professional challenge lies in accurately reflecting the services provided while adhering strictly to payer guidelines and regulatory requirements, particularly concerning upcoding or unbundling. The coder must navigate the ethical imperative to report truthfully and the regulatory mandate to follow specific coding and billing rules. Correct approach analysis. The correct approach involves seeking clarification from the physician. This is best professional practice because it ensures accurate coding based on complete and correct documentation. The Certified Professional Medical Coder Certification exam emphasizes adherence to the ICD-10-CM and CPT coding guidelines, as well as payer-specific policies. By querying the physician, the coder can obtain the necessary documentation to support the services rendered, thereby avoiding potential violations of the False Claims Act and Medicare fraud and abuse regulations. This proactive step upholds the integrity of the billing process and ensures compliance with the principle of medical necessity as documented. Incorrect approaches analysis. One incorrect approach involves coding the higher-paying service without further investigation. This is a direct violation of coding ethics and regulations. It constitutes upcoding, which is fraudulent and can lead to severe penalties, including fines and exclusion from federal healthcare programs. This action disregards the requirement for documentation to support the code assigned and violates the principle of accurate reporting. Another incorrect approach is to code the lower-paying service without attempting to clarify the physician's intent. While this avoids upcoding, it may not accurately reflect the services provided and could lead to underpayment, which, while not fraudulent, can still impact revenue and potentially misrepresent the practice's service volume. More importantly, it fails to uphold the coder's responsibility to ensure the most accurate and appropriate code is assigned based on the full clinical picture. A third incorrect approach is to ignore the discrepancy and proceed with coding based solely on the initial, potentially incomplete documentation. This demonstrates a lack of diligence and a failure to adhere to the professional standard of ensuring all coding decisions are supported by comprehensive and accurate documentation. It can lead to both under- or overcoding, depending on the nature of the discrepancy, and fails to meet the coder's obligation to accurately represent the services rendered. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accurate documentation and regulatory compliance. This framework involves 1. Identifying discrepancies or ambiguities in documentation. 2. Consulting relevant coding guidelines and payer policies. 3. Seeking clarification from the ordering physician or provider when documentation is insufficient or contradictory. 4. Assigning codes that accurately reflect the services rendered and are fully supported by the documentation. 5. Documenting all queries and the rationale for coding decisions. This systematic approach ensures ethical practice and regulatory adherence. Question 4. Risk assessment procedures indicate a potential for coding inaccuracies due to variations in physician documentation. A medical record for a patient presenting with chest pain includes a physician's note stating, "Patient reports intermittent chest discomfort, worse with exertion. Rule out myocardial infarction. EKG shows nonspecific ST changes. Chest X-ray unremarkable. Plan. Admit for observation, cardiac enzyme monitoring, and further evaluation." Which of the following coding approaches best reflects the introduction to medical coding principles and regulatory compliance? Option A. Assign codes for chest pain and a definitive diagnosis of myocardial infarction based on the physician's initial concern, even though it was not confirmed. Option B. Assign codes for chest pain and observation services, querying the physician for further clarification on the specific type of chest pain and the definitive diagnosis if one is established during observation. Option C. Assign codes for chest pain and nonspecific ST changes, assuming a diagnosis of myocardial infarction is likely given the symptoms. Option D. Assign a code for chest pain based on the chief complaint and a code for a general observation service without further investigation into the specific findings. The correct answer is B. Assign codes for chest pain and observation services, querying the physician for further clarification on the specific type of chest pain and the definitive diagnosis if one is established during observation. Explanation. This scenario presents a common challenge in medical coding, accurately identifying and assigning codes based on incomplete or ambiguous documentation. Professional coder must navigate the inherent uncertainty to ensure compliance with coding guidelines and regulatory requirements, while also supporting accurate reimbursement and data integrity. The challenge lies in balancing the need for specificity with the reality of clinical documentation, which may not always be perfectly detailed. The correct approach involves a systematic process of reviewing the documentation, identifying key clinical terms, and consulting authoritative coding resources to select the most appropriate ICD-10-CM and CPT codes. This adheres to the principle of coding to the highest level of specificity supported by the documentation, as mandated by official coding guidelines. It also reflects best practice in ensuring that the codes accurately represent the patient's condition and the services rendered, which is crucial for accurate billing, statistical analysis, and quality reporting. An incorrect approach would be to make assumptions or infer information not explicitly stated in the medical record. This violates the fundamental rule of medical coding, which prohibits coding based on assumptions. Such actions can lead to inaccurate coding, potentially resulting in claim denials, audits, and even fraudulent billing. Another incorrect approach would be to assign codes based solely on the patient's chief complaint without considering the physician's assessment and plan. This fails to capture the full clinical picture and the services provided, leading to incomplete and inaccurate coding. Finally, choosing codes based on perceived ease of reimbursement rather than clinical accuracy is a direct violation of ethical coding principles and regulatory compliance. The professional decision-making process for similar situations involves a thorough review of the medical record, including physician notes, test results, and other relevant documentation. When ambiguity exists, the coder should query the physician for clarification. This collaborative approach ensures that the coding reflects the physician's intent and the patient's actual clinical situation. Adherence to official coding guidelines and professional ethical standards is paramount throughout this process. Question 5. The performance metrics show a consistent pattern where certain complex procedures are frequently coded at a lower level of specificity than the physician's narrative suggests, leading to potential under-reimbursement. The physician's documentation for these procedures is detailed, but occasionally lacks explicit statements that directly map to the highest specificity code descriptors. Option A. Assign the highest specificity code based on the physician's narrative, assuming the detailed description implies the full scope of the service, even without explicit code descriptor mapping. Option B. Code the procedure using a less specific code that is clearly supported by the existing documentation, accepting the potential for under-reimbursement to avoid any compliance risk. Option C. Initiate a physician query to request clarification or addenda to the documentation, specifically asking for details that align with the higher specificity code descriptors, before assigning the most appropriate code. Option D. Manually add clarifying phrases to the physician's existing documentation to ensure it fully supports the highest specificity code before submitting the claim. The correct answer is C. Initiate a physician query to request clarification or addenda to the documentation, specifically asking for details that align with the higher specificity code descriptors before assigning the most appropriate code. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a discrepancy exists between the physician's documentation and the coded services. The professional coder must navigate this gap, ensuring accurate reimbursement while adhering to strict regulatory requirements. The challenge lies in balancing the need for complete and accurate coding with the ethical obligation to reflect the services actually rendered and documented. Misinterpreting or ignoring documentation can lead to significant compliance issues, including fraud and abuse allegations. Correct approach analysis. The correct approach emphasizes the foundational principle of medical coding. If it wasn't documented, it wasn't done. This principle is deeply embedded in U.S. healthcare regulations, particularly those enforced by the Centers for Medicare and Medicaid Services, CMS, and the Office of Inspector General, OIG. Accurate coding relies entirely on the physician's medical record. When documentation is insufficient or ambiguous, the coder cannot ethically or legally assign codes that are not supported by the record. Querying the physician for clarification is the best practice, as it allows for the documentation to be amended or clarified, thereby supporting the correct coding of services rendered. This aligns with the False Claims Act and other anti-fraud statutes, which penalize submitting claims for services not rendered or not documented. Incorrect approaches analysis. One incorrect approach involves coding based on assumptions or what is typically done for a given diagnosis. This violates the principle of coding based solely on documentation. It can lead to upcoding or billing for services not performed, which constitutes fraud and abuse under federal law. This practice bypasses the essential requirement for a documented medical necessity and service delivery. Another incorrect approach is to ignore the discrepancy and proceed with coding as if the documentation were complete. Failure to identify and address documentation gaps is a direct contravention of coding guidelines and regulatory expectations. It can result in inaccurate claims being submitted, leading to overpayments or underpayments, and potential audits with severe financial penalties. It also fails to uphold the coder's responsibility to ensure the integrity of the billing process. A third incorrect approach is to alter the documentation to match the desired codes. This is a severe ethical and legal violation. Tampering with medical records is illegal and can result in criminal charges, loss of licensure, and significant fines. It undermines the entire healthcare system's reliance on accurate and truthful record-keeping. Professional reasoning. When faced with a documentation coding discrepancy, a professional coder must prioritize accuracy and compliance. The decision-making process should involve 1. Thoroughly reviewing the medical record to identify the specific documentation deficiency. 2. Consulting official coding guidelines, e.g., IC 10cm CPT, to understand the coding requirements for the services in question. 3. Initiating a physician query to obtain clarification or additional documentation. 4. If clarification is not possible or does not resolve the issue, coding only to the level of documented service, even if it means assigning a less complex code. 5. Documenting all actions taken, including physician queries and the rationale for the final coding decision. This systematic approach ensures that all claims submitted are accurate, compliant, and ethically sound. Question 6. Strategic planning requires a medical coder to proactively identify and address potential issues that could impact accurate claim submission and organizational compliance. If a medical coder observes a consistent pattern of incomplete physician documentation that prevents accurate assignment of ICD-10cm and CPT codes, what is the most appropriate course of action to support both coding integrity and efficient revenue cycle management? Option A. Refuse to code any encounters with incomplete documentation until all deficiencies are fully resolved, regardless of the impact on claim submission timelines. Option B. Assign the highest possible reimbursement codes based on the limited documentation to maximize revenue, hoping the claims will be processed without issue. Option C. Proceed with coding the encounters using the incomplete documentation, assuming the physician will provide necessary details later to avoid delaying claim submission. Option D. Flag the documentation deficiencies to the Health Information Management (HIM) department and the responsible physician for clarification and correction, while continuing to code based on available information and adhering to coding guidelines. The correct answer is D. Flag the documentation deficiencies to the Health Information Management (HIM) department and the responsible physician for clarification and correction, while continuing to code based on available information and adhering to coding guidelines. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical coder to balance the immediate need for accurate coding with the broader organizational goals of compliance and efficient revenue cycle management. The pressure to expedite coding without compromising accuracy can lead to errors that have significant downstream consequences, including claim denials, audits, and potential regulatory penalties. The coder must exercise sound judgment to identify potential issues and escalate them appropriately, rather than simply processing claims as quickly as possible. Correct approach analysis. The correct approach involves a proactive and analytical stance. By identifying a pattern of incomplete documentation that could lead to inaccurate coding, the medical coder is demonstrating a commitment to the core principles of the Certified Professional Medical Coder certification. This involves not only applying coding guidelines, but also understanding the impact of documentation quality on reimbursement and compliance. The coder's action of flagging the issue for review by the HIM department, and the physician directly addresses the root cause of potential coding errors. This aligns with the ethical responsibility to ensure accurate representation of patient care and to uphold the integrity of healthcare data. This approach supports the organization's strategic planning by preventing future coding inaccuracies, reducing claim denials, and mitigating compliance risks, all of which are critical for financial stability and operational efficiency. Incorrect approaches analysis. One incorrect approach involves proceeding with coding based on the incomplete documentation, assuming the physician will clarify later. This is a significant regulatory and ethical failure. It violates the principle of coding based on documented facts, as outlined in coding guidelines and payer policies. Inaccurate coding due to insufficient documentation can lead to fraudulent claims, which carry severe penalties under regulations like the False Claims Act. Ethically, it misrepresents the services provided and can impact patient care continuity if subsequent providers rely on inaccurate coding. Another incorrect approach is to ignore the incomplete documentation and code to the highest paying code possible, hoping it will pass. This is a direct violation of coding ethics and regulatory compliance. It constitutes upcoding, which is a form of fraud and abuse. Coders are ethically bound to code accurately and compliantly, not to maximize reimbursement through deceptive practices. This behavior can lead to audits, recoupments, and severe sanctions against both the coder and the healthcare organization. A third incorrect approach is to simply refuse to code any encounters with incomplete documentation, without any attempt to resolve the issue. While accuracy is paramount, a complete refusal without escalation or seeking clarification can hinder patient care and revenue cycle operations. This approach fails to demonstrate professional problem-solving and collaboration. While it avoids direct coding errors, it doesn't contribute to improving the documentation process, which is a key role of a medical coder in supporting the organization's strategic goals. It also fails to meet the ethical obligation to facilitate accurate and timely reimbursement for services rendered. Professional reasoning. Professionals should approach this situation by first recognizing the potential impact of incomplete documentation on coding accuracy and compliance. The decision-making process should involve 1. Identifying the discrepancy between the documentation and the coding requirements. 2. Consulting official coding guidelines and payer policies to understand the implications of the missing information. 3. Communicating the issue clearly and professionally to the appropriate parties, e.g., HIM department physician with specific examples. 4. Documenting the communication and the steps taken. 5. Escalating the issue if it is not resolved and continues to pose a risk. This systematic approach ensures that coding is accurate, compliant, and supports the overall health of the organization's revenue cycle. Question 7. Consider a scenario where a physician's progress note documents a patient presenting with acute exacerbation of chronic obstructive pulmonary disease with associated bronchospasm. The coder needs to select the most appropriate ICD-10-CM codes. Which of the following represents the most accurate and compliant coding approach? Option A. Assign a code for acute exacerbation of COPD and a separate code for bronchospasm, ensuring both are sequenced according to ICD-10-CM guidelines. Option B. Assign a code for acute exacerbation of COPD and a code for chronic obstructive pulmonary disease, as the exacerbation implies the underlying chronic condition. Option C. Assign a single code that encompasses both the acute exacerbation of COPD and the bronchospasm, as these conditions are often related. Option D. Assign a code for bronchospasm and a code for a general respiratory infection, as these are common causes of COPD exacerbations. Correct answer is A. Assign a code for acute exacerbation of COPD and a separate code for bronchospasm, ensuring both are sequenced according to ICD-10-CM guidelines. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, accurately translating complex medical terminology and anatomical descriptions into standardized codes. The challenge lies in the potential for ambiguity in physician documentation, the need for precise understanding of anatomical structures and their relationships, and the requirement to adhere to specific coding guidelines. Misinterpretation can lead to inaccurate claims, potential audits, and financial repercussions for the healthcare provider, as well as negatively impacting patient care data. Correct approach analysis. The correct approach involves a thorough understanding of medical terminology and anatomy, coupled with diligent reference to the official coding guidelines and the ICD-10-CM, or relevant diagnostic coding system for the specified jurisdiction, tabular list. This ensures that the chosen code precisely reflects the documented diagnosis, including all relevant anatomical sites and pathological conditions. Best professional practice dictates that coders must possess a strong foundation in medical knowledge and apply it rigorously to the coding process, cross-referencing documentation with authoritative coding resources to ensure accuracy and compliance with regulatory requirements. This meticulous process minimizes the risk of errors, and upholds the integrity of medical records and billing. Incorrect approach is analysis. One incorrect approach involves relying solely on a general understanding of the terms without consulting specific coding resources. This can lead to the selection of codes that are too broad, too specific, or entirely incorrect, failing to capture the nuances of the documented condition. This violates the principle of accurate representation of patient care and can lead to non-compliance with payer requirements. Another incorrect approach is to assume the meaning of a term based on its common usage rather than its precise medical definition. Medical terminology often has specific meanings within the healthcare context that differ from everyday language. This can result in miscoding and misrepresentation of the patient's condition, potentially leading to improper treatment or reimbursement. A third incorrect approach is to prioritize speed over accuracy by selecting the first code that appears to match the documentation without verifying its appropriateness against the full diagnostic statement and coding guidelines. This haste can overlook critical details in the documentation or coding rules, leading to significant errors and potential regulatory violations. Professional reasoning. Professionals in this field must adopt a systematic approach. First, thoroughly review the physician's documentation, identifying all key terms related to diagnosis, anatomy, and any associated conditions. Second, utilize a comprehensive medical dictionary and anatomical atlas to clarify any unfamiliar or ambiguous terminology. Third, consult the official coding classification system, e.g., ICE 10cm, and its accompanying guidelines, paying close attention to instructional notes, inclusion/exclusion terms, and sequencing rules. Finally, cross-reference the selected code with the documentation to ensure a perfect match. This iterative process of review, research, and verification is crucial for accurate and compliant medical coding. Question 8. The investigation demonstrates a patient presenting for follow-up care and management of symptoms directly attributable to a primary malignant neoplasm that was surgically removed and treated with radiation therapy 2 years prior. There is no current evidence of metastatic disease documented. The physician's documentation focuses on the ongoing effects and management of the sequelae from the original treatment and the primary tumor site. Which of the following coding approaches best reflects the patient's current clinical status and the reason for the encounter, adhering to ICD-10cm coding guidelines for neoplasms? Option A. Assign a code for a secondary malignant neoplasm, assuming the current symptoms are a manifestation of residual cancer. Option B. Assign a code solely for the current symptom or condition, without referencing the history of the primary neoplasm. Option C. Assign a code for the personal history of malignant neoplasm of the primary site, along with a code for the specific sequela or symptom being managed. Option D. Assign a code for a benign neoplasm of the affected organ, as the malignant neoplasm has been removed. The correct answer is C. Assign a code for the personal history of malignant neoplasm of the primary site, along with a code for the specific sequela or symptom being managed. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, accurately representing a complex neoplastic diagnosis that has undergone treatment. The challenge lies in discerning the appropriate ICD-10cm code to reflect the current encounter's purpose, considering the history of a treated neoplasm. Coders must navigate the guidelines for coding secondary malignant neoplasms and the status of a treated primary neoplasm, ensuring the code accurately communicates the patient's condition to payers and healthcare providers for appropriate reimbursement and clinical decision-making. Misinterpretation can lead to claim denials, incorrect data collection for cancer registries, and potentially impact future patient care. Correct approach analysis. The correct approach involves identifying the primary neoplasm as the underlying cause of the current condition, even if it has been treated. ICD-10cm guidelines specifically address coding for secondary malignant neoplasms and the status of a treated primary neoplasm. When a patient is seen for a condition that is a direct result of a previously treated primary malignancy, the coder must assign a code for the secondary malignant neoplasm if it is the focus of the encounter. However, if the patient is seen for a condition that is not a secondary malignancy, but is a sequela or complication of a treated primary neoplasm, the primary neoplasm code should be used with an appropriate external cause code if applicable, or a code for the sequela itself. In this case, the patient is presenting with symptoms directly related to the treated primary neoplasm, not a new secondary malignancy. Therefore, coding the primary neoplasm with a status code indicating it is a personal history of malignant neoplasm, and then coding the current symptom or condition is the most accurate representation. This aligns with the principle of coding the condition that occasions the present medical service. Incorrect approaches analysis. Assigning a code for a secondary malignant neoplasm without clear documentation of a new, distinct metastatic site originating from the primary neoplasm is a regulatory failure. This misrepresents the patient's condition and can lead to incorrect reimbursement and data reporting. Coding only the current symptom or condition without acknowledging the underlying history of the treated primary neoplasm is also a failure. This omits crucial clinical context that influences patient management and can lead to incomplete medical records. Assigning a code for a benign neoplasm when the history clearly indicates a malignant primary neoplasm is a significant error. This mischaracterizes the severity and nature of the patient's past condition, impacting both clinical understanding and potential future coding. Professional reasoning. Professionals should approach this situation by first thoroughly reviewing the physician's documentation to understand the reason for the current encounter. They must then consult the ICD-10-CM official guidelines for coding and reporting, specifically sections pertaining to neoplasms, personal history, and secondary malignant neoplasms. The key decision point is whether the current encounter is for a new secondary malignancy or for a condition related to the treated primary neoplasm. If the latter, the coder must determine if a sequela code or a personal history code is most appropriate, often in conjunction with a code for the presenting symptom or condition. This systematic approach ensures compliance with coding standards and accurate representation of patient care. Question 9. Upon reviewing the medical record of a patient presenting for a follow-up appointment, the physician documents patient continues to experience significant anxiety, which is exacerbating their pre-existing hypertension, requiring adjustment of both psychotropic and antihypertensive medications. The physician's assessment also notes a new diagnosis of adjustment disorder with anxious mood. The patient's hypertension is well controlled with current medication, but has worsened due to the increased anxiety. Which of the following coding approaches best reflects the documentation and adheres to ICD-10-CM coding guidelines for this encounter? Option A. Assign a code for adjustment disorder with anxious mood and a code for anxiety, with no code for hypertension as it is being managed. Option B. Assign a code for hypertension as the principal diagnosis, followed by a code for adjustment disorder with anxious mood. Option C. Assign a code for anxiety disorder as the principal diagnosis, followed by a code for hypertension. Option D. Assign codes for adjustment disorder with anxious mood as the principal diagnosis, followed by a code for the exacerbation of hypertension due to the anxiety. Correct answer is D. Assign codes for adjustment disorder with anxious mood as the principal diagnosis, followed by a code for the exacerbation of hypertension due to the anxiety. Explanation. This scenario presents a professional challenge due to the nuanced nature of coding for mental health conditions, particularly when comorbidities are present. Accurate coding is crucial for proper reimbursement, statistical tracking, and ensuring patients receive appropriate care. The challenge lies in selecting the most specific and accurate ICD-10-CM codes that reflect the patient's documented diagnoses and their impact on the encounter, adhering strictly to official coding guidelines. The correct approach represents best professional practice because it prioritizes the official ICD-10-CM coding guidelines, which are the definitive source for accurate medical coding in the United States. These guidelines mandate the sequencing of codes based on the principal diagnosis and the accurate representation of all documented conditions that coexist at the time of the encounter and affect patient care. Specifically, when a patient presents with a mental disorder and a related physical condition, the guidelines dictate how to code these relationships to ensure the documentation accurately reflects the patient's overall health status and the services provided. This meticulous adherence to guidelines ensures compliance with payer requirements and promotes accurate data for public health and research. An incorrect approach that fails to identify and code the exacerbation of a pre-existing mental disorder when it is the reason for the encounter, or when it significantly impacts the management of a physical condition, represents a regulatory failure. This can lead to underreporting of mental health conditions, potentially affecting resource allocation and patient care planning. Another incorrect approach that assigns a less specific code when a more specific one is documented and supported by the medical record is also a failure. This violates the principle of coding to the highest level of specificity, which is a fundamental tenet of accurate medical coding, and can lead to reimbursement issues and inaccurate statistical reporting. Furthermore, failing to code a documented comorbidity that affects patient care or treatment decisions is a significant ethical and regulatory lapse, as it misrepresents the patient's clinical picture and the complexity of the services rendered. Professionals should employ a decision-making process that begins with a thorough review of the entire medical record, including physician documentation, progress notes, and any diagnostic reports. They must then consult the current ICD-10-CM official guidelines for coding and reporting to determine the appropriate principal diagnosis and any secondary diagnoses. When dealing with mental health conditions and comorbidities, specific guidelines regarding the relationship between mental and physical disorders must be carefully applied. If documentation is unclear or ambiguous, the coder must query the physician for clarification to ensure the most accurate and compliant code assignment. This systematic approach, grounded in official guidelines and clear communication, is essential for maintaining professional integrity and ensuring accurate healthcare data. Question 10. The evaluation methodology shows that understanding the nuances of various healthcare delivery systems is paramount for effective medical coding. Which of the following approaches best demonstrates a coder's ability to adapt their expertise to different healthcare delivery models to ensure accurate coding and revenue cycle integrity? Option A. Prioritizing the speed of coding to meet the perceived demands of a particular healthcare delivery system, even if it means occasional reliance on assumptions. Option B. Proactively analyzing how the structure and payment models of a healthcare delivery system influence clinical documentation and patient encounters to anticipate and address potential coding challenges. Option C. Focusing exclusively on the technical application of ICD-10-CM and CPT codes, assuming all documentation is complete and accurate regardless of the delivery system. Option D. Relying on established coding conventions, without considering how the specific healthcare delivery system might alter documentation practices or service delivery. The correct answer is B. Proactively analyzing how the structure and payment models of a healthcare delivery system influence clinical documentation and patient encounters to anticipate and address potential coding challenges. Explanation. The evaluation methodology shows a need to assess the impact of different healthcare delivery systems on coding accuracy and revenue cycle management. This scenario is professionally challenging because coders must understand how the structure of care delivery influences documentation, which directly impacts the codes assigned and subsequent reimbursement. A coder's ability to navigate these complexities is crucial for financial integrity and compliance. The correct approach represents best professional practice because it directly links the understanding of healthcare delivery systems to the core responsibilities of medical coding. By analyzing how different systems, e.g., integrated delivery networks, fee-for-service, accountable care organizations, affect documentation patterns, patient flow, and payer interactions, coders can proactively identify potential coding challenges, ensure accurate code assignment, and optimize the revenue cycle. This aligns with the Certified Professional Medical Coder certification's emphasis on comprehensive knowledge beyond just code lookup, requiring an understanding of the broader healthcare environment as mandated by industry standards and best practices for efficient and compliant healthcare operations. An incorrect approach that focuses solely on the technical aspects of coding without considering the delivery system fails to acknowledge the root causes of documentation deficiencies or coding variations. This can lead to persistent coding errors, under or overcoding, and ultimately, financial discrepancies and compliance risks. For instance, ignoring the impact of a capitated payment model on physician documentation might result in missed opportunities to capture all billable services, impacting revenue. Another incorrect approach that prioritizes speed over accuracy, driven by the perceived pressures of a particular delivery system, directly violates ethical coding standards and regulatory requirements for accurate representation of services rendered. This can lead to significant compliance issues, including audits and penalties. A third incorrect approach that relies on assumptions about documentation quality without verifying against the actual delivery system's characteristics is equally flawed. This lack of due diligence can result in misinterpretations of clinical documentation, leading to incorrect coding and potential fraud or abuse allegations. The professional reasoning process for coders in such situations involves a systematic approach. First, understanding the specific healthcare delivery system in place, e.g., its payment models, provider relationships, patient access protocols. Second, analyzing how this system influences clinical documentation practices and the completeness of patient records. Third, applying coding guidelines and principles to the documented services, considering any system-specific nuances. Finally, advocating for improved documentation or process adjustments when systemic issues are identified that compromise coding accuracy and compliance. Question 11. Examination of the data shows a 32-year-old female, G2P1, at 28 weeks gestation, presenting for a routine prenatal visit. Her medical history includes well-controlled hypertension, diagnosed prior to pregnancy. The physician's documentation notes the pregnancy is progressing normally, but the hypertension requires ongoing monitoring throughout the gestation. Which coding approach best reflects the patient's clinical status and adheres to U.S. coding regulations for this encounter? Option A. Code for the pregnancy with a secondary code for pre-existing hypertension complicating pregnancy. Option B. Code for the pregnancy with a secondary code for gestational hypertension. Option C. Code for the pregnancy without any mention of hypertension. Option D. Code only for the pre-existing hypertension. The correct answer is A. Code for the pregnancy with a secondary code for pre-existing hypertension complicating pregnancy. Explanation. Scenario analysis. This scenario presents a common challenge in obstetrical coding, where a patient presents with a pre-existing condition that impacts the management of their pregnancy. Accurately capturing both the pregnancy status and the complicating condition is crucial for appropriate reimbursement, quality reporting, and understanding the patient's overall health status during this vulnerable period. The professional challenge lies in selecting the most specific and accurate ICD-10-CM codes that reflect the full clinical picture, adhering strictly to coding guidelines and the payer's requirements, which are governed by U.S. federal regulations and payer policies for the Certified Professional Medical Coder Certification exam. Correct approach analysis. The correct approach involves identifying the principal diagnosis and any secondary diagnoses that are relevant to the current encounter. For a patient with a pre-existing condition that affects pregnancy management, the guidelines dictate that the pregnancy-related condition is typically sequenced first, followed by codes for the pre-existing condition as it relates to the pregnancy. This ensures that the primary reason for the encounter, pregnancy, is recognized, while also acknowledging the significant impact of the coexisting condition. This aligns with ICD-10-CM official guidelines for coding and reporting, which emphasize coding all conditions that coexist at the time of admission that affect patient care or management. Incorrect approaches analysis. One incorrect approach would be to code only the pre-existing condition without acknowledging the pregnancy. This fails to capture the primary reason for the patient's encounter and would misrepresent the clinical situation, potentially leading to incorrect reimbursement and data analysis. It violates the principle of coding all relevant diagnoses. Another incorrect approach would be to code the pregnancy without the pre-existing condition. This omits a critical piece of information that influences the patient's care and management, leading to an incomplete clinical picture. It also fails to meet the requirement of coding all conditions that affect patient care. A third incorrect approach might involve using less specific codes for either the pregnancy or the pre-existing condition when more specific codes are available and applicable. This can lead to underreporting of the complexity of the patient's condition and may not accurately reflect the services provided, potentially impacting reimbursement and quality metrics. Professional reasoning. Professionals should approach such scenarios by first identifying the principal diagnosis, which is the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. In obstetrical cases, this is often related to the pregnancy itself. Next, they must identify all other conditions that coexist at the time of the encounter and affect patient care or management. This requires a thorough review of the medical documentation, including physician notes, operative reports, and diagnostic test results. The coder must then consult the ICD-10-CM official guidelines for coding and reporting, and any specific payer guidelines to determine the correct sequencing and selection of codes. This systematic process ensures accurate and compliant coding. Question 12. Performance analysis shows a consistent pattern of coders struggling to accurately assign the principal diagnosis when a patient presents with multiple chronic conditions and an acute exacerbation of one of those conditions. A recent audit highlighted instances where the principal diagnosis was incorrectly assigned to a chronic condition rather than the acute exacerbation that necessitated the current encounter. Which approach best reflects the correct application of coding guidelines in this scenario? Option A. Assign the chronic condition that has been previously diagnosed and treated as the principal diagnosis, as it represents a significant ongoing health issue. Option B. Assign the acute exacerbation as the principal diagnosis if it is the condition that prompted the patient's admission or encounter, after reviewing physician documentation for the reason for care. Option C. Identify the condition that required the most resources or longest length of stay as the principal diagnosis. Option D. Code all documented chronic conditions and the acute exacerbation, sequencing them alphabetically to ensure all diagnoses are captured. The correct answer is C. Identify the condition that required the most resources or longest length of stay as the principal diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a patient has multiple coexisting conditions, and the coder must accurately reflect the complexity of the patient's health status for proper reimbursement and quality reporting. The challenge lies in determining the principal diagnosis and sequencing secondary diagnoses appropriately, especially when one condition may be a manifestation or complication of another, or when multiple conditions independently impact patient care. Accurate coding requires a thorough understanding of coding guidelines, including conventions for sequencing, and the ability to interpret physician documentation to identify the conditions chiefly responsible for the admission or encounter. Correct approach analysis. The correct approach involves a systematic review of the medical record to identify all documented diagnoses. The coder must then apply the ICD-10-CM official guidelines for coding and reporting to determine the principal diagnosis, which is defined as the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for inpatient care. For outpatient encounters, the principal diagnosis is the condition chiefly responsible for the encounter. Secondary diagnoses are then sequenced in order of importance to the patient's care. This approach ensures compliance with regulatory requirements for accurate reporting of patient conditions, which directly impacts reimbursement, quality metrics, and public health data. Adhering to the ICD-10-CM guidelines is paramount for maintaining the integrity of the coding system and ensuring consistent, comparable data. Incorrect approach is analysis. Coding only the most severe-sounding diagnosis without considering the physician's stated reason for the encounter or admission is a regulatory failure. This can lead to inaccurate principal diagnosis assignment, violating the ICD-10-CM official guidelines for coding and reporting, which mandates sequencing based on the condition chiefly responsible for the encounter or admission. This also misrepresents the patient's care needs and can negatively impact quality reporting. Coding all documented conditions without proper sequencing or consideration of cause and effect relationships is another failure. While it captures all conditions, it fails to identify the principal diagnosis and may not accurately reflect the primary reason for the patient's interaction with the healthcare system, thus violating sequencing guidelines and potentially leading to incorrect reimbursement and data analysis. Coding only the diagnosis that appears first in the physician's notes, regardless of its relationship to the encounter or admission, is a common but incorrect practice. This ignores the explicit instructions within the ICD-10-CM official guidelines for coding and reporting, which prioritize the condition chiefly responsible for the encounter or admission over mere chronological order in the documentation. This can lead to inaccurate principal diagnosis assignment and misrepresentation of the patient's medical necessity for care. Professional reasoning. Professionals should approach this by first thoroughly reviewing the entire medical record, including physician notes, test results, and discharge summaries. They must then consult the ICD-10-CM official guidelines for coding and reporting, paying close attention to sections on sequencing of diagnoses, coding of signs and symptoms, and guidelines for specific conditions. When documentation is unclear or contradictory, the coder should query the physician for clarification to ensure accurate and compliant coding. This systematic, guideline-driven approach, coupled with effective communication with the physician, is essential for ethical and accurate medical coding. Question 13. The audit findings indicate that a patient was treated for a fractured tibia sustained during a recreational soccer game. The physician's notes detail the mechanism of injury as a direct blow to the leg from another player's foot. The notes also mention the incident occurred on a public park field. Which of the following coding approaches best reflects the accurate and compliant reporting of external causes of injury for this encounter? Option A. Assign codes for the fractured tibia and a code for the mechanism of injury as contact with another player's foot. Option B. Assign codes for the fractured tibia and a general code for injury unspecified as the external cause. Option C. Assign codes for the fractured tibia and a code for the activity of playing soccer and a code for the place of occurrence as a public park. Option D. Assign codes for the fractured tibia and a code for the activity of playing soccer, but omit the place of occurrence as it is not critical. The correct answer is C. Assign codes for the fractured tibia and a code for the activity of playing soccer and a code for the place of occurrence as a public park. Explanation. Scenario analysis. This scenario is professionally challenging because accurately coding external causes of injury requires a thorough understanding of the patient's encounter, the mechanism of injury, and the specific coding guidelines. Coders must go beyond the primary diagnosis to capture the circumstances surrounding the injury, which can be complex and require interpretation of physician documentation. The challenge lies in selecting the most specific and appropriate external cause codes from a vast array of options, ensuring compliance with reporting requirements without overcoding or undercoding. Correct approach analysis. The correct approach involves meticulously reviewing the physician's documentation to identify all relevant details pertaining to the injury's cause, place of occurrence, and activity. This includes understanding the difference between the initial encounter, subsequent encounter, and sequela codes for external causes. By selecting the most specific external cause codes that accurately reflect the patient's situation, the coder ensures compliance with reporting mandates, facilitates accurate data collection for public health initiatives, and supports appropriate reimbursement. This aligns with the principles of accurate and complete medical record documentation and coding, as mandated by coding guidelines and regulatory bodies governing medical coding in the U.S. Incorrect approaches analysis. One incorrect approach would be to assign only a general external cause code without specifying the activity or place of occurrence if that information is available. This fails to meet the specificity requirements of external cause coding, hindering detailed injury surveillance and analysis. It represents a failure to fully utilize available documentation and adhere to coding guidelines that encourage specificity. Another incorrect approach would be to assign external cause codes that are not supported by the physician's documentation. This could lead to inaccurate data and potentially fraudulent claims if the codes do not reflect the actual circumstances of the injury. This is an ethical and regulatory failure, as it misrepresents the patient's encounter and violates principles of honest and accurate reporting. A third incorrect approach would be to omit external cause codes entirely, even when the documentation clearly indicates an external cause for the injury. This is a direct violation of reporting requirements for certain types of injuries and can lead to incomplete data for public health tracking and research. It demonstrates a lack of understanding of the importance and mandatory nature of external cause coding in specific circumstances. Professional reasoning. Professionals should approach external cause coding by first identifying the primary diagnosis and then thoroughly reviewing the entire medical record for details about how the injury occurred. They should consult the ICD-10-CM official guidelines for coding and reporting, specifically the sections on external causes of morbidity and mortality, to understand the hierarchy and specificity of code selection. When documentation is unclear or incomplete, the coder should query the physician for clarification rather than making assumptions. This systematic approach ensures accuracy, compliance, and the capture of crucial data for injury prevention and research. Question 14. Analysis of a patient's medical record reveals a physician's note detailing a patient's presentation for a routine follow-up appointment after a successful surgical procedure for a benign tumor 6 months prior. The physician's note states, "Patient is recovering well from prior surgery. No signs of recurrence. discussed potential long-term monitoring due to family history of similar tumors. Which of the following coding approaches best reflects the appropriate use of ICD-10-CM codes for this encounter, considering the physician's documentation? Option A. Assign a code for the benign tumor and a code for the family history of malignant neoplasm. Option B. Assign a code for the current status of the patient as recovering from surgery and a code for the encounter for screening of a benign neoplasm. Option C. Assign a code for the current status of the patient as recovering from surgery and a code for the family history of a benign neoplasm. Option D. Assign a code for the current status of the patient as recovering from surgery and a code for the family history of malignant neoplasm. The correct answer is A. Assign a code for the benign tumor and a code for the family history of malignant neoplasm. Explanation: scenario analysis. This scenario presents a professional challenge for a medical coder due to the nuanced nature of coding factors influencing health status. Z codes. These codes are not for conditions that are currently treated or diagnosed, but rather for circumstances that may affect a patient's health or their need for healthcare services. The difficulty lies in accurately identifying when a Z code is appropriate and distinguishing it from a primary diagnosis, especially when the patient's record might contain information that could be misinterpreted. The coder must possess a thorough understanding of ICD-10-CM guidelines and the specific documentation requirements for these codes to ensure accurate and compliant billing. Correct approach analysis. The correct approach involves meticulously reviewing the patient's medical record to identify specific documentation that supports the use of a Z code. This includes looking for explicit statements from the physician or other qualified healthcare provider indicating that a factor is influencing the patient's health status or the encounter. For example, if a patient presents for a routine checkup and the physician notes a history of a resolved condition that might impact future health, or a social determinant of health that is being addressed, a Z code would be appropriate. This approach aligns with ICD-10-CM official guidelines for coding and reporting, which emphasize coding all documented conditions that coexist at the time of the encounter and require or affect patient care, treatment, or management. It also adheres to the principle of coding based on physician documentation, ensuring that the codes accurately reflect the patient's clinical picture and the services provided. Incorrect approaches analysis. One incorrect approach would be to assign a Z code based solely on a patient's medical history, without explicit physician documentation linking that history to the current encounter or influencing the patient's health status. This fails to meet the documentation requirements for Z codes and could lead to inaccurate coding, potentially misrepresenting the patient's condition or the reason for the visit. Another incorrect approach is to assign a Z code for a condition that is actively being treated or diagnosed during the encounter. Z codes are for factors influencing health status, not for current illnesses or injuries that are the primary reason for the visit. Signing a Z code in such a situation would violate coding guidelines and misrepresent the patient's medical necessity. A third incorrect approach is to omit Z codes entirely, even when they are clearly documented and supported by the physician's notes. This would result in an incomplete coding picture, potentially failing to capture important contextual information about the patient's health status and the factors influencing their care, which could impact quality reporting or risk adjustment. Professional reasoning. Professionals should approach coding for factors influencing health status by first understanding the purpose of Z codes, to provide additional information about a patient's encounter when a condition is not a current illness or injury. The decision-making process should involve a systematic review of the medical record, focusing on physician documentation. Key questions to ask are: is there a documented factor that influences the patient's health status? Does this factor affect the patient's current care, treatment, or management? Is this factor the primary reason for the encounter, or is it a secondary consideration? When in doubt, coders should query the physician for clarification to ensure accurate and compliant coding. This systematic approach, grounded in coding guidelines and clear documentation, ensures that the patient's record is accurately represented and that billing is appropriate. Question 15. Quality control measures reveal that a medical coder is attempting to resolve a discrepancy on a submitted claim by accessing a patient's entire electronic health record, including notes from previous unrelated visits and diagnostic imaging reports that are not pertinent to the current claim services. The coder's stated intent is to get a better understanding of the patient's overall health status, to justify the coding. Option A. The coder should access the entire electronic health record to gain a comprehensive understanding of the patient's health, as this aids in accurate coding. Option B. The coder should contact the patient directly to request clarification on the services billed, as this is a direct way to resolve discrepancies. Option C. The coder should access only the specific encounter documentation and billing information directly related to the claim in question, adhering to the minimum necessary standard for PHI access. Option D. The coder should share the patient's full medical record with a colleague in the billing department for a second opinion on the coding. The correct answer is C. The coder should access only the specific encounter documentation and billing information directly related to the claim in question, adhering to the minimum necessary standard for PHI access. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings where the need to access patient information for legitimate purposes, like billing or quality review, intersects with the strict requirements of HIPAA. The challenge lies in balancing operational efficiency with patient privacy rights, requiring coders to understand the nuances of permissible disclosures and authorized access. Correct approach analysis. The correct approach involves a thorough review of the patient's medical record and associated billing documentation by an individual authorized to access protected health information. 5. For the specific purpose of verifying coding accuracy and ensuring proper reimbursement. This aligns with HIPAA privacy rule, which permits covered entities to use and disclose PHI for healthcare operations, including quality assessment and improvement activities, and for payment purposes, provided that the use or disclosure is limited to the minimum necessary PHI. The coder, acting on behalf of the covered entity, is authorized to access this information for these specific, legitimate business functions. Incorrect approach is analysis. Accessing the patient's full medical record without a clear, documented need related to the specific billing inquiry or quality review is a violation of the HIPAA privacy rule's minimum necessary standard. This standard mandates that covered entities limit the use or disclosure of PHI to the minimum necessary to accomplish the intended purpose. Sharing the patient's PHI with a colleague not directly involved in the specific billing or coding review, even if they are also a coder, constitutes an unauthorized disclosure under HIPAA. Access to PHI must be restricted to individuals with a legitimate need to know for their job functions. Contacting the patient directly to clarify information that should be available within the medical record or through internal communication channels with the physician's office is an unnecessary disclosure of PHI and bypasses established protocols for resolving billing discrepancies. This could also be construed as a breach of privacy if the patient is not expecting such a call, or if the information shared is not handled with appropriate security measures. Professional reasoning. Professionals should approach such situations by first identifying the specific purpose for accessing PHI. If the purpose is related to billing or coding review, they must determine what minimum information is required to achieve that objective. They should then consult internal policies and procedures regarding PHI access and disclosure. If any doubt exists about the permissibility of an action, seeking guidance from the organization's privacy officer or compliance department is the most prudent step. This ensures adherence to HIPAA regulations and ethical coding practices. Question 16. Strategic planning requires a thorough understanding of how to accurately represent medical services using the current procedural terminology, CPT code set. When encountering a complex surgical procedure documented in a patient's medical record, what is the most appropriate method for selecting the correct CPT code, adhering to the structure and formatting principles of the CPT manual? Option A. Identify the primary procedure performed and locate the corresponding code in the CPT manual, ensuring to review any associated guidelines, parenthetical notes, and the hierarchical relationship with other codes to select the most specific and accurate representation of the service. Option B. Choose a code based on common terminology used in the operative report, assuming that the most frequently used terms will correspond to the correct CPT code. Option C. Report the procedure using a general code that encompasses multiple services if the documentation is extensive, to simplify the billing process. Option D. Select a code that appears similar to the documented procedure without verifying its specific guidelines or placement within the CPT manual's organizational structure. The correct answer is A. Identify the primary procedure performed and locate the corresponding code in the CPT manual, ensuring to review any associated guidelines, parenthetical notes, and the hierarchical relationship with other codes to select the most specific and accurate representation of the service. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where the precise application of CPT code structure and formatting is critical for accurate reimbursement and compliance. Misinterpreting the hierarchical nature of CPT codes, the significance of modifiers, or the specific guidelines for reporting services can lead to significant financial penalties, audit failures, and reputational damage. The professional coder must possess a deep understanding of the CPT manual's organizational principles to correctly identify and report the most appropriate code for a given service. Correct approach analysis. The correct approach involves a systematic review of the patient's medical record, identifying all services rendered, and then consulting the CPT manual to select the most specific and accurate code. This includes understanding the relationship between parent codes and their associated add-on codes, as well as the appropriate use of modifiers to further define the service. This adherence to the CPT manual's structure and formatting ensures compliance with payer requirements and accurately reflects the services provided, which is a cornerstone of ethical and professional medical coding practice under U.S. regulatory frameworks. Incorrect approaches analysis. One incorrect approach would be to select a code based solely on keywords found in the operative report, without verifying its placement within the CPT manual's hierarchy or considering any applicable guidelines. This fails to acknowledge the structured nature of CPT codes and can lead to the selection of an unbundling code or a less specific code, violating the principle of reporting the most accurate service. Another incorrect approach would be to ignore the presence of specific instructions or parenthetical notes within the CPT manual that modify the use of a particular code. These notes are integral to the code's formatting and application, and their disregard can lead to incorrect coding and noncompliance with payer policies. A third incorrect approach would be to assume that a single CPT code can encompass multiple distinct procedures without verifying if the code description allows for such reporting or if separate codes are required. This demonstrates a misunderstanding of how CPT codes are designed to represent discrete services and can result in under- or overcoding. Professional reasoning. Professionals should approach CPT coding by first thoroughly understanding the patient encounter documented in the medical record. They must then engage with the CPT manual as a structured resource, paying close attention to code descriptions, guidelines, parenthetical notes, and the hierarchical relationships between codes. When in doubt, consulting official coding resources, payer guidelines, or seeking clarification from experienced coders or coding professionals is essential. This methodical process ensures accuracy, compliance, and defensible coding practices. Question 17. Research into the proper coding of radiology procedures has revealed a situation where a physician requests a specific CPT code for a diagnostic imaging study, stating it best reflects the clinical intent of the procedure. However, the detailed operative report and associated imaging findings do not fully support the complexity or specific elements typically associated with the requested code, though they do support a lower-level related code. The coder is faced with the decision of how to report this service accurately according to the Certified Professional Medical Coder Certification, CPMC framework. Option A. Code the procedure using the lower-level, related CPT code that is fully supported by the detailed operative report and imaging findings. Option B. Code the procedure using the CPT code requested by the physician, as their clinical intent is paramount. Option C. Report the requested CPT code, but append a modifier to indicate the discrepancy between the documentation and the physician's request. Option D. Query the physician for further clarification on the documentation and the rationale for the requested code, referencing the specific guidelines and documentation discrepancies. Correct answer is B. Code the procedure using the CPT code requested by the physician, as their clinical intent is paramount. Explanation. This scenario presents a professional challenge due to the inherent conflict between a physician's request and the established coding guidelines, particularly concerning the accurate representation of services rendered. The coder must navigate the ethical obligation to report services truthfully and accurately according to the Certified Professional Medical Coder Certification, CPMC framework, while also respecting the physician's clinical judgment. The core of the challenge lies in determining if the physician's request for a specific code aligns with the documented evidence and the payer's requirements, without compromising coding integrity. The correct approach represents best professional practice because it prioritizes adherence to the official coding guidelines and payer policies, which are the bedrock of accurate medical billing and reimbursement. By seeking clarification and reviewing the documentation thoroughly, the coder upholds the principles of ethical coding, ensuring that services are reported precisely as performed and justified by the medical record. This aligns with the CPMC emphasis on integrity and accuracy in coding, preventing potential fraud or abuse. An incorrect approach that involves coding the requested code without sufficient documentation or justification fails to adhere to the fundamental principle of, if it's not documented, it wasn't done. This can lead to overcoding, which is a violation of payer policies and potentially fraudulent. Another incorrect approach, coding a less complex service than documented to appease the physician or avoid conflict, results in undercoding, which is also unethical and can negatively impact reimbursement and the physician's practice metrics. Blindly accepting the physician's request without independent verification of documentation and guidelines disregards the coder's professional responsibility and the established regulatory framework for coding. Professionals should employ a decision-making framework that begins with a thorough review of the medical documentation. If there is ambiguity or a discrepancy between the documentation and the physician's request, the next step is to consult the official coding guidelines and payer policies. If clarification is still needed, the professional should engage in a direct, respectful conversation with the physician to understand their intent and to explain the coding implications based on the documentation and guidelines. This collaborative approach ensures accuracy, compliance, and ethical practice. Question 18. The risk matrix shows a moderate likelihood of coding errors when patients present with a constellation of symptoms and abnormal laboratory results without a confirmed diagnosis. A physician documents patient presence with fever, cough, and elevated white blood cell count. The physician's assessment notes rule out pneumonia. Which coding approach best reflects the current coding guidelines for this scenario? Option A. Code for pneumonia, as it is being ruled out. Option B. Code the signs and symptoms fever, cough, and the abnormal finding elevated white blood cell count, as they are documented and a definitive diagnosis is not yet established. Option C. Do not assign any codes until a definitive diagnosis is provided by the physician. Option D. Code only the elevated white blood cell count, as it is an objective laboratory finding. The correct answer is B. Code the signs and symptoms fever, cough, and the abnormal finding, elevated white blood cell count, as they are documented and a definitive diagnosis is not yet established. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a patient presents with symptoms and abnormal findings, but a definitive diagnosis is not yet established. The professional coder must navigate the guidelines for coding signs and symptoms versus definitive diagnoses, ensuring accurate reimbursement and appropriate medical record documentation. The challenge lies in interpreting the physician's documentation and applying the correct coding conventions when a definitive diagnosis is absent, which can impact patient care tracking and statistical reporting. Correct approach analysis. The correct approach involves coding the signs and symptoms documented by the physician when a definitive diagnosis has not been established. This aligns with the ICD-10-CM official guidelines for coding and reporting, which state that signs and symptoms that are not integral to a disease process should be coded when a definitive diagnosis has not been made. This ensures that the patient's condition is represented accurately in the absence of a confirmed diagnosis, facilitating appropriate billing and supporting the medical necessity of services rendered. Incorrect approaches analysis. Coding a definitive diagnosis that is not explicitly stated by the physician is a regulatory failure. This violates the principle of coding based on physician documentation and can lead to inaccurate reporting, potential fraud and abuse allegations, and improper payment. It bypasses the established coding guidelines that require a confirmed diagnosis for specific code assignment. Coding only the abnormal laboratory finding without considering the associated signs and symptoms is also an incorrect approach. While the abnormal finding is significant, the patient's presentation is often a combination of symptoms and findings. Coding only one aspect may not fully capture the clinical picture, and could lead to incomplete or inaccurate coding, potentially affecting the assessment of the patient's overall condition and the justification for further diagnostic workup or treatment. Failing to code any condition because a definitive diagnosis is not yet established is a failure to represent the patient's actual clinical encounter. The patient presented with specific signs and symptoms that warrant coding, even if a final diagnosis is pending. This approach would result in an unbilled or inaccurately billed encounter, impacting revenue cycle management and failing to document the services provided. Professional reasoning. Professionals should approach such scenarios by thoroughly reviewing the physician's documentation, identifying all documented signs, symptoms, and abnormal findings. They must then consult the ICD-10-CM official guidelines for coding and reporting to determine the appropriate coding hierarchy. When a definitive diagnosis is absent, the guidelines direct coders to report the signs and symptoms. This systematic approach ensures compliance with regulatory requirements, promotes accurate data collection, and supports appropriate reimbursement. Question 19. Compliance review shows a patient presented to the emergency department with a deep laceration to the forearm sustained during a fall while walking on an icy sidewalk. The physician's documentation clearly describes the injury and notes the fall occurred due to the slippery conditions. Which of the following coding approaches best reflects the required specificity and adherence to ICD-10-CM guidelines for this scenario? Option A. Assign a code for the laceration and a code for the external cause of the injury, specifying the fall and the slippery surface as the circumstances. Option B. Assign a code for the laceration and a code for a general fall, without specifying the location or cause of the fall. Option C. Assign a code for the laceration and a code for the icy weather conditions, without linking it directly to the fall. Option D. Assign a code for the laceration only, without further detail on how the injury occurred. Correct answer is D. Assign a code for the laceration only, without further detail on how the injury occurred. Explanation. Scenario analysis. This scenario is professionally challenging because accurately coding injuries and poisoning requires a thorough understanding of the ICD-10-CM official guidelines for coding and reporting, specifically the sections pertaining to external causes of morbidity and mortality, and the nuances of poisonings versus toxic effects. The coder must differentiate between accidental, intentional self-harm, assault, and undetermined intent, and correctly identify the substance involved and whether it was taken as prescribed or not. Misinterpretation can lead to inaccurate data collection, impacting public health statistics, reimbursement, and patient care. Correct approach analysis. The correct approach involves meticulously reviewing the medical record to identify all relevant details. This includes the specific injury or poisoning, the circumstances surrounding it, e.g., accidental fall, intentional overdose, the substance involved if a poisoning, and whether the substance was taken as prescribed or not. Coding should then follow the ICD-10-CM guidelines for external causes of morbidity and mortality, Chapter 20, and the guidelines for poisonings and toxic effects, Chapter 19. This ensures accurate representation of the patient's condition and the events leading to it, aligning with the principles of accurate and complete medical record documentation and coding as mandated by coding standards. Incorrect approaches analysis. An approach that focuses solely on the primary diagnosis without considering the external cause codes is incorrect because it fails to capture the full picture of the patient's encounter. ICD-10-CM requires the use of external cause codes to describe how, when, and where an injury or poisoning occurred, which is crucial for statistical analysis and injury prevention efforts. This omission violates the principle of complete coding, an approach that assigns a poisoning code without verifying if the substance was taken as prescribed or not, or without differentiating between accidental, intentional, or assault, is incorrect. The ICD-10-CM guidelines provide specific codes to distinguish these circumstances. Failing to do so leads to inaccurate reporting of the intent and nature of the poisoning, which can have significant implications for patient safety and public health data. An approach that uses a generic injury code without specifying the type of injury or the external cause is incorrect. ICD-10-CM provides highly specific codes for various types of injuries and their external causes. Generic coding obscures important details about the injury mechanism and location, hindering accurate data analysis and potentially impacting treatment decisions or preventative measures. Professional reasoning. Professionals should approach coding for injuries and poisonings by first identifying the principal diagnosis. Then they must thoroughly search the medical record for information pertaining to the external cause of the injury or poisoning. This involves looking for details about the intent, accidental, intentional, assault, undetermined, the place of occurrence, and any activity the patient was engaged in. For poisonings, it is critical to identify the specific substance and whether it was taken as prescribed or not. The coder must then consult the ICD-10-CM official guidelines for coding and reporting to select the most specific and appropriate codes from chapters 19 and 20, ensuring all relevant aspects of the encounter are captured accurately. This systematic approach ensures compliance with coding standards and provides valuable data for healthcare analysis. Question 20. Which approach would be most appropriate for a certified professional medical coder when encountering a patient encounter form with incomplete physician documentation regarding the patient's diagnosis, preventing the assignment of definitive ICD-10-CM codes? Option A. Query the physician for clarification on the diagnosis before assigning codes. Option B. Assign codes based on the patient's reported symptoms and general medical knowledge. Option C. Delay coding the encounter until the physician provides complete documentation, regardless of the impact on billing timelines. Option D. Code based on information provided by the nursing staff who assisted the physician. The correct answer is A. Query the physician for clarification on the diagnosis before assigning codes. Explanation. Scenario analysis. This scenario presents a common implementation challenge in medical coding, ensuring accurate and compliant coding practices when faced with incomplete or ambiguous documentation. The professional coder must navigate the tension between providing timely reimbursement and upholding the integrity of medical records and billing. This requires a deep understanding of coding guidelines, payer policies, and ethical responsibilities. Correct approach analysis. The correct approach emphasizes the coder's responsibility to seek clarification from the physician when documentation is insufficient to assign accurate codes. This aligns with the fundamental principles of medical coding, which mandate that codes must accurately reflect the services rendered and the diagnosis supported by the medical record. The Certified Professional Medical Coder certification emphasizes adherence to official coding guidelines, e.g., ICD-10-CM, CPT, and payer-specific rules. Seeking clarification ensures that the coder is not making assumptions or extrapolating information, which could lead to inaccurate coding, potential fraud, and compliance violations. This proactive communication is a hallmark of best professional practice, fostering a collaborative environment and ensuring the highest level of coding accuracy. Incorrect approaches analysis. One incorrect approach involves assigning codes based on assumptions or external knowledge not present in the medical record. This directly violates the principle that coding must be based solely on documented evidence. Such an approach can lead to upcoding billing for services not rendered or at a higher level than documented, or downcoding billing for services at a lower level than documented, both of which have serious financial and legal ramifications, including potential fraud and abuse investigations. Another incorrect approach is to delay coding indefinitely until perfect documentation is available. While accuracy is paramount, excessive delays can negatively impact healthcare facility revenue cycles and patient care coordination. However, this approach is less egregious than assigning inaccurate codes, as it avoids direct misrepresentation. The primary failure here is a lack of efficient workflow management and communication to resolve documentation issues promptly. A third incorrect approach is to code based on the patient's stated symptoms or the information provided by non-physician staff without physician attestation. Medical coders are trained to code based on the physician's documented assessment and plan. Symptoms alone, without a physician's diagnosis or evaluation, are not sufficient for accurate code assignment. This approach bypasses the physician's clinical judgment, which is the foundation of medical coding, and can lead to incorrect diagnoses and procedures being billed. Professional reasoning. When faced with ambiguous or incomplete documentation, a professional medical coder should follow a structured decision-making process. First, thoroughly review the available documentation to identify the specific areas of ambiguity or missing information. Second, consult official coding guidelines and any relevant payer policies to understand the rules governing the situation. Third, if clarification is still needed, initiate a query to the physician or appropriate healthcare provider, clearly stating the information required to assign accurate codes. This query process should be documented. Finally, once clarification is received, assign the codes based on the updated and complete documentation. This systematic approach ensures accuracy, compliance, and ethical practice.